So we picked up running. Maybe you're just beginning, or maybe you've been running for a while, but you've increased your mileage, and now we're dealing with hip pain on the outside of the hip. Hip impingement can be really frustrating, but it's generally something we're going to take care of pretty quickly. The first visit in our office is going to include an exam to make sure this is exactly what we're dealing with. And then we have to take a look at all of the joints surrounding that area. It may be the hip or the knee or ankle, it may be further up the chain. The exam will tell us what joints are restricted and not moving well, so we can use a chiropractic adjustment or a mobilization to make sure those are moving in the ranges that they're supposed to. And then we're going to go in and address all of the soft tissue around that area. There's a lot of muscles around the hip that control where the knee goes whenever we're running. And if those aren't doing their job, other muscles will kick on to try and protect you. And a lot of times we're just dealing with tension and irritation around that. This may look like needling or my hands or tool work, but we'll do whatever we need to do to make sure that those muscles are, one, not having as much pain, but two, letting your hip go through the range of motion it should. Now, once we've done all this work, we want to make it stick. So we're going to add some exercises to make sure that you're not having to see me for the rest of your life just to be able to run a few miles. So let's take a look at a few of those. And when it comes to hip impingement, strength around the hips is going to be really important. So after we've stretched these out and opened up all that range of motion, we have to add a lot of control to this. Now, one of the exercises I like for this is a 90-90 rotation. From this position, you're going to lift this knee off the floor, try to squeeze your glute to keep this knee on the ground as long as you can. You're welcome to lean back if this is too difficult, and you're working your way towards being upright with this. But we want to lift this knee off, and you're going to try to squeeze those glutes to get it as far off the ground as you possibly can before that other knee pops off. You're continuing to fight to keep those away from each other as long as you can. All the way to there, and then we're going to finish that rotation to 90-90 on this side. Same thing, we're going to repeat back to the other direction. Try to keep the front knee down as we lift that back knee as high as we can. Once that pops off, you continue to fight those away from each other until you get that knee down, and then the other one can come along for the ride. And we're going to repeat this for somewhere between 5 to 10 reps to get you ready for running again. Now, hip impingement is something we really commonly see in our runners, and so I believe that you need to have enough strength to be able to run. I think you need to earn it, and one of our favorite ways to do that is everyone's least favorite exercise, a rear foot elevated split squat. We're going to start seated on a bench. You're going to straighten one leg out, and that's going to tell you where your front foot will be. We will come up to that position, and your rear foot is going to be back on the bench. Now, most people stay upright as we do this position, and that's going to put it more into the quad. But for this, we want it more back in the hip and the glutes. So I want you to get a slight forward lean like you're in a sprint position. And we're going to do this starting with body weight, but as you add load to it, I want you holding a goblet position. You're going to hold a kettlebell or a dumbbell like a goblet. Keep that sprint position as we work our way down and up with this. Now, I like to start most people with about 8 reps, and as you do this sprint position, you should feel a ton through the hips and glutes here, and this is going to help to add single leg strength, which is really good when we're doing a lot of running. Now, those are a couple of the common exercises we use in the beginning for hip impingement, but it really depends on what we find in the exam. You're different than everyone else, and so your treatment should be tailored to you. So go ahead and get on the schedule today so that we can do a full exam and treat you based off of that.